Hey folks, we'll go ahead and get started here in about 1 minute, right? Just 1 minute warning, just in case anybody didn't. Please make sure you're signing in with your name, agency, and email, and then after about 60 seconds, we'll go ahead and get kicked off. Thanks. All right, folks. Well, making sure you're in the right place, right? You are here for the Omnibus Eviction and Homelessness Prevention Program, also affectionately known as OEHP, because we love our acronyms over here at DCA. You're in the TA session, which will be the singular TA session for this procurement opportunity, right? So by way of introductions, right, my name is Mike Callahan. I'm the director of the Office of Homelessness Prevention, right? And I'm just going to go ahead and list off the team members that are here with us today, right? So from my office, um, right, my office, we have Tina McGill, who's the assistant director of the Office for Programs and Operations, Jen Debiak, right, who's the program lead, Matt Horvath, who's the contract administrator that's going to be working on the team. Um, on this. And then also too, right, I just want to pass over just for quick introductions and a quick word, right, over to Dean Daffis, Director of the Office of Eviction Prevention. Dean? All right, my apologies.
Dean's
I was going.
experiencing some technical
Yes,
difficulties.
I gotcha. So anyway, right, so Dean Daffis, Director of the Office of Eviction Prevention, right, will be on shortly. As and from the team over at OEAP, right, we have Pauline Manilow, the program specialist, right, Casey Kleck, the program specialist, Harold Shlomo, right, contract administrator. And for today's agenda, what we're really going to work through, right, are the policy framework, right, why we're doing this and kind of how we're doing this, program design and eligible activities, and also to application submission and scoring, performance reporting and compliance. And we will be having a Q&A session with additional TA resources at the end. Importantly, right, this webinar is being recorded as it is recording, so will the transcript, this slide deck, both slide decks, and other materials will be available immediately after the webinar. So if you registered, right, we have your email address on file, but we also like to have a backup here with the transcript. That's why we asked you to sign in. We're going to blast those materials off right after this, right? Given that it's the end of the day, we will not have this up on YouTube until probably about midday tomorrow. But as long as you were either signed in or you had registered for this email or for this TA session, we will go ahead and put that out to everybody on that distro list, right? Um, so without further ado, we'll kind of kick off and dive into the first parts of why we're here and kind of what we've done to merge some of these programs, right? So particularly, right, many folks that are on this call have either been a grantee of the program formerly known as CEDD, or they've been a grantee of the Homelessness Prevention Program, right? What we're really trying to do with this, right, as I know that we have many folks on the call that are aware of some of the challenges coming from HUD currently, and that some of the other challenges
Sure.
there. But
Okay.
I'm gonna go ahead and mute everybody just in case we're on, right? But with that, right, one of the things that we are going to have over the next year, right, is a precipitous increase in homelessness that is brought about by eviction, right? As such, in doing this, right, from a policy perspective here at the department, we are aligning the deployment of the homelessness prevention program, which is primarily an eviction resolution program, even though it leads with homelessness, with CEDD, right? This does not mean anything for the offices. It does not mean anything. This is just driving a better interoperability between both the Office of Eviction Prevention and the Office of Homelessness Prevention. And similarly, so we're braiding funding streams to achieve optimization and deeper impact across all. Um, With that, right, the purpose, right, of OEHP, right, is really to prevent displacement and reduce homelessness inflows through a coordinated system of financial assistance, legal intervention, case management, and navigation services, right? Um, and understanding this, right, we're really trying to stand up a systematic prevention pipeline that stabilizes households before homelessness occurs, but also most importantly, right, and Dean will touch on this really poignantly in the closing today, right? Why the secret sauce of this program is a resource navigator paired with legal counsel with a stable financial assistance pathway, right? Similarly, for folks that are looking right, also through this program itself is we are also building the infrastructure by which those entities that are participating in the Medicaid housing supports program, particularly as tenancy sustainment services, right, are going to be able to access those flexible financial funds in addition, and kind of so that we'll all be able to get a little bit more mileage out of our collective efforts across the state, right? So when we look more globally from a strategic perspective, right, are the specific program objectives that are going to be measurable, right, on this are one, to provide financial stabilization assistance, right, through rental arrears coverage, relocation assistance, and flexible funds to ensure legal advocacy is available statewide, right, for tenants in eviction or eviction-like proceedings, to employ resource navigators and HPP navigators, right, acting as the central point of contact for households in each vicinage, and to build county and prevention networks that really are integrating those social services providers, legal aid organizations, and also to working with our local housing authorities, courts, continuums of care, and other entities that are interested at the table, right? A lot of what you're going to see in this RFP, it is very heavy from a data governance perspective, right? And through this, right, we are really putting forward that, in this era of increasingly decreasing funds, in this era of, right, this forced optimization throughout everything, right, we really need to ensure that as we're delivering services, right, we're able to provide all of our partners, whether that's New Jersey courts, whether that's county governments, whether that's advocates, whether that's other stakeholders, right, and whether it's the legislature, right, for rapid, transparent data, and that we're able to go and stand that up and look through in near real time or real time, to go and make sure that we're not only reaching the populations that we need to be, but that we're rapidly identifying gaps that are emergent throughout the ecosystem, right? Similarly, right, this is kind of a blending model and moving completely over to performance-based management, right? And where grantees are going to be held accountable for performance outcomes, right? And looking at maintaining at least 85% housing retention or successful placement relocation for those cases that are enrolled, right, for through those cases that end up going through the case management process of this, right? And similarly with this, right, the other policy goal of this is across the state, right, to establish uniform statewide standards for navigator salaries, disbursement timelines, data entry, and compliance. And so through this, we really want to take a stab at and also work collaboratively together to eliminate the variation between counties and between vicinages, right? As we look at HPP and as we look at CEDD across the state, its prior deployments, right? There's tremendous variability between where you're receiving services and how that's happening, right? While there's not a lot we can control for, we can control for the actual governance and operations of the program, and that's why both offices are going to have a little bit more heavier hand in the day-to-day operations than probably most folks are used to, right? Um, and so with this, right, I'm going to go ahead and kick it back over to our great programs team, right? So Jen Debiak and Casey Clack, happy to pass the torch over to you.
Thanks, Mike. I'm going to go first, and then Jen will pick it up. So let's start with the target population. So general eligibility, it's going to be households that are at imminent risk of eviction or at imminent risk of homelessness. Households have to reside in rental dwellings within New Jersey, and without OEHP, housing will likely be lost or result in homelessness. Income limitations, we're going to stick with the at or below 80% AMI. We've had that before with CEDD and HPP, and providers have to maintain documentation of that income. Next slide. Mike, next slide. Thanks. So our population is going to be subject to those who are subjected to eviction and eviction-like proceedings. So commonly, you're going to see landlord-tenant court filings, most likely, ejectment actions. Those will be the DC dockets. You'll see those occasionally. Administrative termination of rental subsidies. We're going to see those increasingly. Termination of occupancy rights in federally subsidized housing, same thing. We're going to see those increasing. Constructive evictions, which are cases where habitability issues, harassment, or illegal lockouts have forced the household to evict. Next slide. And our eligible activities. I'm gonna do these pretty quickly just because I'm assuming that most of, if not all of you, have already read the RFP or at least skimmed it. So I just want to do this briefly so we can get to the Q&A because I'm sure folks will have plenty of questions. So our first eligible activity component 1 is going to be that resource navigation with our resource navigators and HPP navigators. Those are going to be functioning basically as the same position. We just have classified it as resource navigator and HPP navigator. That was a common question that we were getting. And the minimum is going to be 20 households per navigator, both of those per navigator per month. And their roles are going to be to screen for eligibility across various programs, guide households through financial assistance and legal referrals, process them for HPP arrears assistance and flex funds. And we're tightening up on the eligible costs with this. Navigator salaries are going to be at minimum $65,000 plus 35% fringe. That's a hard stop, a hard line for us. We want to provide statewide standards for navigator salaries with this RFP. Technology, so that's going to be laptop, cell phones, office and administrative support, transport for client meetings. Some of the performance requirements, besides the 20 households per navigator per month, are going to be that intake for households should be completed within 48 hours, and HIMIS entry should be completed within 24 hours. Next slide. For component 2, that's going to be the HPP assistance. So all households are going to be screened for HPP first. We're hoping that will be able to we'll have a more organized way of having households be screened for HPP and flex funds to prevent duplication that we were seeing before, because they're going to be both in-house. So the HPP, that's a statutorily authorized assistance under NJAC 541 with objectives to prevent eviction judgments for non-payment, stabilizing households by paying arrears, serving as the first line of financial support. Eligible costs are going to be 3 months of rental arrears, court legal and late fees, relocation, and the performance requirements with those that is going to be the payments have to be dispersed within 72 hours. That's a notable change from the previous grant. Flex funds and HPP assistance have to be dispersed within 72 hours. Written agreements from landlords, and they have to be reported as HPP assistance in HMIS. Next slide. Okay, component 3. It's going to go hand in hand with HPP, the relocation assistance to support households who can't remain in their houses, with their objectives being preventing shelter entry and ensuring relocated units are habitable. Eligible costs are going to be the security deposit, first and second month's rent, utility deposits, and moving expenses. And our performance requirements are going to be assigned lease and proof of occupancy. With that relocation, and units have to meet habitability standards, and they're going to be reported separately from arrears and HMIS. And then we also have OEHP flexible funds for crisis stabilization. So those are going to be our low barrier funds, rapid response funds that we were seeing previously under CEDD. And those are going to fill the program gaps that HPP cannot address. So if someone is not qualifying for HPP and there are still funds available, they can be processed for flex funds. They're supposed to resolve short-term crises, and the eligible costs for those are going to be rental assistance arrears gap, or rental arrears assistance gaps, utility arrears, habitability items, transportation, short-term hotel motel stays, lock changes, and domestic violence related safety needs. And then the performance requirements of those are going to be same day or 72-hour disbursement. And they're going to be recorded under OEHP Flex Funds and HIMIS, and they have to be complementary and non-duplicated with HPP. Next is going to be legal services for those providers who are legal services providers. And that's going to be all households receiving intensive supports are going to have access to legal review. So that's a change from the previous grant cycle. All households who will be intensive case management households are going to receive at least legal review. So they're going to look over the case and have some brief advice on their specific matter. The objectives of this are going to be provide legal advice, full representation, court attendance where necessary, preserve tenancies, know your rights trainings, eligible costs, attorney salaries in part. One change from the last grant cycle is that we are no longer going to be able to pay for attorney salaries in full. It's going to be partial for this go around. Outreach and education materials, and then performance requirements, mandatory attendance at all landlord-tenant court sessions in respective vicinage, mandatory weekly case conferencing with social providers in that vicinage as well. So that's going to be where legal providers are going to get the case information about the tenants that have intensive support. Legal review of all case management households, as I mentioned previously, track and report legal outcomes monthly, and a HIMIS entry for all legal engagements. Component 6 is going to be what Mike mentioned, the data entry. We're having more stringent requirements this go around as well. Objectives, ensure 100% intakes, disbursements, legal cases are logged, provide timely reports to us for monitoring. Eligible costs, it's going to be NJ HIMIS licenses and fees, data quality staff, technology for mobile data entry, and the performance requirements are the same that I mentioned before, intakes in 24 hours, as well as monthly reconciliation of financials with HMIS records and quarterly data quality reviews. Okay, eligible activities. Component 7. So this is going to be court attendance and systems coordination. So the goal with this is to kind of embed navigators and the legal services providers into the landlord-tenant court ecosystem. So we need to maintain a visible OEHP presence at court. So that's attending court regularly for resource navigators, HPP navigators, and legal services providers, and coordinating with judges and court staff to connect tenants. Eligible costs are going to be travel for navigators, attorneys to court, portable tech, outreach materials, and the performance requirements, coverage for every landlord-tenant session in their respective vicinage. Court engagement is going to be logged into HIMIS, and monthly schedules should be submitted to OEP. Available funding. So because this is a consolidated grant with HPP and CEDD's allocations, where we have 7,041,000 in available funding. The 2.541 million is HPP, 4.5 from CEDD. And of this amount, 1 million is going to be reserved for our legal services providers. So those are going to be for legal services providers. The remaining 6,041 is going to be for social services providers. Okay, so for our funding, we've allocated the regions with 3 different categories in each region for funding, right? It's going to be the flexible client assistance funds. So that's going to be the arrears assistance. So that's going to be HPP, relocation, flex funds. That's all in one bucket, right? It's just going to be classified based on what the client has been screened and processed as, whether it was HPP, arrears, or flex funds. So that's not something you're going to be able to delineate in your budget. Right now, you're just going to be able to say flexible client assistance funds. Navigator staffing funds, so that's salaries and fringe for all navigators. Administrative fit funds, which we've had to tighten up a little bit this grant going around. It's going to be capped at 10% of the total allocation. So those administrative expenses, data staff, supplies, indirect costs are going to be up in admin. And these allocations we've determined based on historical need and within the constraints we had this time. So some requirements for funding, like I mentioned before, the navigator salaries are going to be at minimum 65,000 plus 35% fringe benefits. We have to submit back your budgets for modifications required if the navigator salaries are not budgeted at 65K. We're trying to make a statewide minimum for this. Administrative caps, that's going to be 10% of the total award, inclusive of indirect costs. The legal services funding is going to be $1 million. Regional coverage. So applicants who are applying for one of the bigger regions that have multiple counties, they have to demonstrate the ability to serve all the counties within that region. So the lead agency is going to be serving all counties, but they are allowed to have subgrantees that can serve 1 or 2 counties within that region. Funding adjustments, we reserve the right to adjust allocations based on demand, performance, or statewide need. So these were the allocations that we saw in the RFP. I'm not going to read them all for you, but just note that we have a couple of large regions. So Region 1 is Burlington, Monmouth, Ocean. Region 2, Atlantic, Cape May, Cumberland, Gloucester, Salem. And Region 3, Hunterdon, Morris, Somerset, Sussex, Warren. The rest of the counties are going to be their own regions. You can apply for multiple regions if you'd like, or counties if you'd like. And these are the amounts for the direct client assistance, admin, staffing, the minimum required resource navigators, minimum required HPP navigators, and the minimum requirement of households served based on that 20 households per navigator per month calculation. And this is just the same thing with the rest of the counties. And then just note for the legal services providers, because we're aiming to support all of the case management households, we have that number based on our projected number of case management households that we're going to be serving. So that's going to be statewide legal services. And yes, that's it for me. I think I'm going to pass the torch off to Jen.
Good afternoon, everyone. My name is Jen Deviak. I am the program lead over in the Office of Homelessness Prevention, and my wheelhouse in this piece is administration of HPP. So we're going to get started with my portion. Important deadlines for this are highlighted for your visibility. So applications are due submitted in Sage by 11:59 p.m. on December 2nd, 2025. We hope to move through the application review process quickly and notify applicants that will be awarded by February 1st, 2026, with projected contracting dates going from February 1st, 2026 through March 31st, 2027. Next slide, please.
Jen, can I jump in for a minute? This is Dean.
Sure.
I just want to announce, I'm sure to everyone's delight, that we are extending the application deadline to 11:59 p.m. 7 days later from December 2nd. That means Tuesday, December 9th. 11:59 p.m. Tuesday, December 9th. And that change is already reflected in Sage. So those folks who are processing an application or about to put one in, you will see that update in Sage already. Thank you, Jen, and I apologize for the interruption.
No worries. That's a good interruption to have. All right. Eligible entities. So eligible applicants for OEHP are nonprofit organizations or municipal governments that can demonstrate a minimum of 3 years experience administering housing stability, homelessness prevention, eviction, diversion, rapid rehousing, or comparable housing programs. You may apply individually or in collaboration with partner organizations. If you are applying collaboratively, there should be a memorandum of understanding that clearly defines roles and responsibilities and should be included with your application. Only one, if we could mute all mics, please. Just gonna mute really quickly. Perfect. Okay. All right. Only one agency is designated the lead agency and will serve as the fiscal and administrative entity for the award, and the total grant amount should not exceed the maximum allocation for the service area denoted in the RFP. Next slide, please. Some required experience. Applicants must demonstrate experience in one or more of the following service domains: eviction prevention and rental arrears assistance. And we are requesting and looking for demonstrated ability to process payments extremely quickly. Legal service coordination, either in-house or through partnership. The ability to provide brief legal advice, full representation, and attendance at landlord-tenant court proceedings. Homelessness diversion and rapid rehousing experience. So supporting households in relocation, providing flexible financial assistance, and creatively diverting from homelessness. Case management and resource navigation, operating programs that employ staff in navigation, housing stabilization, or case management roles. We are really looking for resource navigators to be the go-to in the county and to be able to know and point people to necessary resources. And data compliant reporting and compliance, so evidence of accurate and timely reporting through HIMIS or equivalent data platforms if you are in a county that does not currently use NJ HIMIS. Next slide, please. Okay, our ideal applicant profile. All applicants and sub-applicants must demonstrate that your organizational portfolio is aligned with the intent of the RFP. An established resource network, a publicly affirmed commitment to housing first, and we'll get a little bit more into how you can demonstrate that later in the presentation. A commitment to the inclusion and incorporation of feedback from persons with lived experience and expertise, COC membership and participation, and the capacity to manage this financially in-house. All right, your application process. Proposal must be submitted electronically via Sage. All applicants must submit in Sage a written narrative that describes the following: agency mission and organizational overview, experience and outcomes in providing services, staffing capacity, program design and service delivery for this specific project, a commitment to housing first, the inclusion of persons with lived experience and expertise, and equity and access, the ability to demonstrate adequate data collection and reporting practices, and to show performance and evaluation through the standards that are indicated in the RFP. All applicants must identify the regions or counties that they propose to serve. And if you're applying as part of a collaborative, the lead agency must clearly describe the roles of each partner and submit signed MOUs. All right, budget. Applicants must submit a detailed line item budget using the Sage budget forms and should be consistent with the regional allocations that are provided in Section 4 of the RFP. Budgets must include navigator salaries. If you're a legal provider, should provide legal salaries in part. Administrative costs that can equal or be less than 10% of the total award amount. Direct program assistance broken out by HPP, Flex Fund, relocation and legal services assistance. Costs for data collection and HIMIS, and matching funding sources if applicable. Applicants are encouraged to include budget narratives that explain assumptions, justify costs, and demonstrate cost effectiveness. This piece is graded in the rubric just so for everyone's visibility. Next slide, please. All right, there are many required attachments in Sage. Again, we'll get into where those should be provided in your application. Those include signed application cover page, your organizational chart showing all of the roles and responsibilities in the organization, a board resolution affirming housing first principles, a process map of the project that takes us from intake through discharge, resumes of all OEHP funded staff, and job descriptions for proposed new hires if you are looking to hire for positions that would be paid for via this project, bylaws of the agency, your board meeting schedule, certifications regarding debarment, lobbying, and sam.gov registration, your IRS determination letter, if applicable, your most recent audit or financial statements, MOUs and partnership agreements, persons with lived experience and expertise inclusion policy or an equivalent document, data collection and management plan, and a letter of intent acknowledgement from the local COC.
Important, Jen, do you mind if I interrupt you for 1
Not
second
at all.
on that?
Go for it.
Right. So, folks, importantly, our good friends at HUD have thrown us a curveball, a fastball, a screwball, and something else recently. So all we're asking for, right, if your COC cannot provide you a letter of support, right, we're more than happy to take as part of the application, right, just proof of an email that you submitted in order to obtain that letter of support, given current circumstances. Thanks, Jen.
You're welcome. Can you slide to the next slide also? Thank you so much. So we're just going to go through the rubric really quickly. Applications will be scored on a 100-point scale with additional bonuses up to a maximum of 20 points. Section 1 will focus on organizational capacity and experience. I'm not going to read through every single piece of the rubric, but you definitely should have this in front of you while you are writing and preparing documentation for this application. We worked really hard to ensure that you would know where to put each of these specific items that we are requesting. So you can see there's criteria in the first column, and then there is the section in the SAGE application where we would be looking for that information. So please pay attention to where we are expecting to see that information. Point values for each of the criteria change. Section 1 is going to focus on your mission, alignment, your years of experience, and then the actual description of experience providing rental assistance, supportive services, etc. Next slide, please. All right, section 2 is going to be sort of the meat and potatoes of your application, where you're going to talk about your proposed approach, and the scoring reflects as such. We're looking for a clearly defined project type and service area, and that is just delineated in application program description and service areas, a detailed project process description and map, and qualifications of project staff. All of the sections in the SAGE application are indicated. Next slide. We're continuing with section 2 on the next slide, please. Data collection, management, and reporting processes. Please, again, read very carefully. Something I want to point out is that we are requesting that you provide 2 years of program outcome data utilizing HIMIS or another carrier. So that's going to be something that we're looking to see to ensure that you can move through your homelessness management information system. Partnerships with COC, healthcare, legal services, and other entities, your marketing and outreach plan, a reasonable and allowable budget. And again, all of those sections in the SAGE application where we would expect to find this information are indicated in the second column. Next slide, please. Section 3 is our commitment to best practices, embracing housing first principles. So we are looking for some documentation of board resolution or policy that it's adopting a housing first stance. Centers voices of those with lived experience. Again, another document that proves that that's something that is upheld within your agency. The pursuit of diversity, equity, inclusion, belonging, and access, similar to the first 2 I just spoke about. And then participation in HIMIS, PIT, and other COC activities. We're looking for your NJ HMFA certificate of completion for training for HIMIS, and then demonstrated PIT count participation. Next slide, please. Okay. Section 4 are threshold requirements that's indicated in the RFP, and we'll go through that again later, but these are the minimum requirements that are needed in your application in order for us to move forward with scoring. Section 5 is a commitment to 72-hour payment of delivery of flexible funds. So we are looking for a letter signed by your board committing to payment delivery of no more than 72 hours post-approval of financial assistance. And then section 6, past performance. So we would provide bonus points based on your previous DCA grant administration experiences. And then you can see how we'd score that below. And then applicants must score at least 70 points overall and meet all threshold requirements to be considered for funding. That's your brief overview of that piece of the process. I'm going to pass it over to Matt and Harold to speak about core performance benchmarks and reporting.
Hi, good afternoon. So I'm going to start talk about core performance and benchmarks. So I am the contract administrator for OEHP. And so the first slide, our goal is to keep families housed. At least 85% of households must remain stable or transition to permanent housing within 12 months. Stability counts whether they stay in their unit, move to another permanent unit, or transition into a permanent program like SRAP or Section 8. Programs must get up and running quickly, fully operational within 30 days, and all OEHP funded staff hired within 60 days. Financially help needs to move fast. Arrears, relocation, and flex funds must go out within 72 hours of approval. And flex funds should be same day when possible. Next slide, please. So we'll be measuring both numbers and impact, how many households are served through which funding streams, the total arrears covered, and the average assistance per household, how many households we successfully divert from homelessness, legal outcomes like dismissals, settlements, or avoided judgments, and finally, client satisfaction and feedback through persons with lived experience and expertise processes. To make reporting consistent, OEP and OEHP will provide all tracking templates. So next slide, please.
Harold, we're on the equity benchmark slide.
Oh, okay. Okay, awesome.
It's up. I think you're looking at your internal one.
Okay. And this slide reinforces the outcomes. The outcomes measures household served, financial impact, diversion from homelessness, legal outcomes, and client feedback. Templates for reporting will be provided, as I said. So equity is a core requirement. Agencies must collect and report disaggregated data and make sure services are accessible across race, gender, disability, and geography. If disparities appear, agencies may participate in equity audits and corrective action planning. Grantees are also expected to take part in statewide initiatives, including NJ counts, PIT census, point and time count, quarterly peer learning sessions, and also technical assistance agreements with timely follow-up on recommendations. So I'll now kick it over to Matt, who will continue with the next slide.
Hi, everyone. I'm Matt Horvath, contract administrator here at DCA. So the reporting requirements. So the grantees are expected to maintain rigorous fiscal and program reporting systems to ensure that OEHP funds are used efficiently, effectively, and in compliance with state requirements. Reporting and monitoring will be conducted jointly by the Office of Eviction Prevention and the Office of Homelessness Prevention within the Department of Community Affairs. So for the HIMIS and data reporting, the HIMIS entry, all intakes must be entered into HIMIS within 24 hours of client contact. Categorization, all financial assistance must be coded by funding stream. HPP versus the OEHP flex funds. The data quality, agencies must meet statewide data quality standards, completeness, accuracy, and timeliness. And reconciliation, financial distributions Disbursements must be reconciled with HIMIS data monthly. Next slide. Financial reporting. Monthly financial status reports, or FSR. So the grantee must submit FSRs through Sage no later than the 15th of each month. The reports must include expenditures by budget category, such as administration, personnel, program assistance, and HIMIS. The applicants and subgrantees under OEHP programs must submit budgets and FSRs that clearly itemize both salaries and fringe benefits by staff position. Assign a distinct dollar amount to each role, matching the original budget submission or approved budget modification. Ensure consistency between approved budgets and financial submissions, known as the FSRs, with no deviations unless formally approved through a budget modification request. Expenditures must be reconciled against household level HIMIS data to prevent duplication. For the supporting documentation, agencies must retain receipts, invoices, and disbursement records for all OEHP expenditures, very important in order to get your reimbursements. Landlord agreements and client payment authorizations must be kept on file, and documents must be available upon request during monitoring visits, and we require that agencies maintain physical files. Next slide. Program reporting. Monthly program reports. Grantees must submit monthly reports capturing number of intakes completed, number and type of households assisted, amount and type of financial assistance dispersed, such as HPP arrears, relocation, and flex funds, legal cases open, resolved, and outcomes achieved, and court sessions attended. For the quarterly performance reports, grantees must submit summaries detailing progress against outcome benchmarks, success stories and qualitative feedback, identification of emerging trends or challenges, and then annual program evaluation. At the close of the grant term, each grantee must submit an evaluation analyzing performance against the RFP's goals. Compliance reporting. OEP and OHP will conduct oversight to ensure adherence to fiscal, program, and data standards. This monitoring will include desk reviews, monthly desk reviews to reviews of FSRs and HIMIS submissions, identification of inconsistencies between reported expenditures and HIMIS entries. We'll have site visits, and this will be at least one annual on-site monitoring visit per grantee. We will review case files, financial records, and internal controls, and interviews with program staff and clients as appropriate. And then we'll have corrective action. Agencies with findings will receive a written corrective action plan. These must be implemented within 30 to 60 days. And failure to comply may result in suspension, deobligation, or termination of funds. And now I will turn it over to Tina McGill for this SAGE training.
And just Tina, bear with us for 1 second as we switch decks here. Especially, we just wanted to incorporate some of the changes that Dean announced briefly. So if you just hold on for 1 second, folks, go ahead and get that going for you. All right, Miss McGill, it's all yours.
It would be nice if I turned. Okay. Hello, everyone. Tina McGill here. We will begin our DCA SAGE training for this initiative. Next slide. So to begin your SAGE application, we begin on the left side of your application menu. And just keep in mind that all items on your on the left side and the right side eventually must align with the RFP and with one another. And those will be your application information, your application program description, for project objectives, scope of services, program components, and service areas. Slide. And where you see the pink arrow is where you will begin to review and input your applicant information. Slide. And you will see this tab, and this is where you can update your agency information. It does have an expiration date, and SAGE does not assume that there are no changes. So you have to confirm in SAGE if your agency information is up to date. Verify that your audit has not expired. If your audit has expired, please submit your most recent audit at least 10 days prior to the application's deadline. If your agency's information is not updated or the audit is past due, SAGE will not allow you to submit your application. That is very important. Are appropriate staff listed in the email context with the proper access level? So SAGE sends notifications during the application process regarding your application, modifications, signatures for your FSR, your narratives, revisions, and if the proper person is not listed in SAGE under context, they will miss these important notifications. Slide. Also verify your SAM number is correct and up to date. Verify your vendor number is correct. If your vendor number is not correct, that's going to mess with your payment. Your payment can be forwarded to the address currently in the system, and you may not receive it if you are awarded a contract. If your charity's registration is your charity's registration and mailing information current. If your charity's registration is not current, we are unable to make payment to you if awarded a contract. Slide. And this is where you can input your service areas. Service areas indicate all areas the agency services throughout New Jersey. Slide. Your board of directors. Is your board member list current? If your board is out of compliance or has been inactive for greater than 120 days, we are unable to execute a contract and make reimbursement payments. Ensure that your board is in compliance and your board listing is current in SAGE. And when listing your members in SAGE, please keep their initial board appointment on their start date. Slide. And this pretty pink arrow shows you where you we'll go to your application program description. Slide. Ensure that your sentence begins with a lowercase 2 or 4. Use only one sentence. The sentence is taken directly from the application and transferred into the award cover letter. Use person first language such as individual, persons, and populations. Slide. And we'll look at your project objectives next. So what are the goals, objectives of the proposed project? Include methods and evaluation for each objective and ensure objectives align with the RFP. Also very important. Slide. Scope of services is next. Slide. Scope of services should describe what you are planning on doing for this particular project. Operations, staff responsibilities, hours, etc. Include all information requested in the application process. Program design and service delivery. Do not assume that the review team knows what your program will look like. Indicate if you are using a subgrantee or if you are providing the service directly. Slide. Program components. Slide. It is typical to have only one program component. It's not a problem. Program components need to be added before you will be able to populate your budget, okay? Use your program name, not the agency providing the service, i.e. Mercer County Homelessness Diversion. If you need to edit, delete a program component, but have already added funds in the budget to that specific component, you need to zero it out, the budget, prior to you editing or deleting the program component. List only services allowable in the RFP. Slide. And next will be your service areas. And this is your tab, indicate the service areas for this particular project. For this RFP, applicants must service the entire county or region. Slide. I'm going to pass it to Jen Debiak to continue on. Thank you so much.
Thank you, Tina. My camera, is working. Okay, wonderful. Hello, nice to see you all again. We're going to get into the right side of the SAGE application that will include your statement of board president, project narrative, agency capacity, your Schedule A's, other sources of funding, your SAM documentation, certification sheets, and budget overview. Next slide, please. We saw a lot of questions coming through in the chat regarding uploads, and this is where you should pay attention. This is where we'll get into some of that. Statement of board president, you would click into that link where the arrow indicates. Next slide. All fields are required. This is just a statement that the board president is in agreement with the application being put forth for this RFP. Next slide, please. Project narrative. This is where a lot of information will go in terms of what we're requesting in the application. Next slide, please. Okay, so one of the things I want to point out here is that after you indicate the number of households that will be served via this project, this is an estimate, obviously, we're asking for a lot of information to be provided regarding the project narrative. And there are only, there's only a 5,000 character limit in the box provided, which is about 2 typed pages. If you don't have enough space to adequately respond to the RFP prompts, you'll include documents with requested information and third-party uploads, which we'll show you later. You'll include the following information requested in the RFP. This is in the required narrative section on pages 31 and 32 of the RFP. They're listed below there. You'll see that the numbers are out of order, right? We have 1 and 2, agency, mission, and organizational overview, and then experience and outcomes, but we're skipping 3 and 4 because those portions will be addressed in different parts of the application. You'll talk about housing first commitment, which also will require an upload, which is your board resolution. You're going to speak about your inclusion of persons with lived experience and expertise, and that will also require an upload. You'll speak about equity and access. Data collection and reporting also requires an upload per the rubric, and performance and evaluation information requested on those pages in the RFP. Next page, please. Slide, I'm sorry. Agency capacity is next. You'll click into that link. Next slide. Here you will talk about staffing capacity. So remember that number 3 from the RFP narrative, required narrative section on pages 31 and 32 was not present for program narrative. You'll put your staffing capacity, which also requires an upload, the organizational chart here. Next slide, please. Schedule A personnel. Next slide. Lots of clicking through these slides. So when you click into that link, this is the information that will pop up that will be requested. The percent of hours worked should be equal to the percent of salary being requested from the state. Total dollar amounts listed in personnel should equal the staff time and dollar amounts listed in the budget. Resumes for project staff for current employees that are being paid from this project should be uploaded via that upload link at the bottom. If a position is yet to be filled, you should use that upload link to provide the job description that you will be posting. and a new Schedule A should be created for each position and employee. Schedule A's are incredibly important, so please pay attention to the information you are putting in there. Ensure that it is mirrored in the budget and that it reflects what is indicated in the RFP. Next slide, please. Okay, other sources of funding. Sorry, that circle's a little off there, but you get the point. You see where to click. Next slide. All right. It's important for us to understand the other sources of funding that are related to this project. So you'll list them here in this area, and you'll code them appropriately. And you can see that the codes are listed at the top of that box. It's really important that we understand all of your other DCA funded grants to ensure that we are not duplicating payment for anybody. Next slide, please. If you could mute your mic, that would be wonderful. We're hearing some background noise from somebody. Let me just do that. All righty. We're going to go into the upload for system for award management. Next slide, please. Please pay attention at this point because we get a lot of people that have questions about how to obtain this document, what this document is, providing the correct document. So this is where you'll get all that information. If you're applying for a program where that's federally funded or not via DCA, you need to provide your proof of registration in the system for award management that is called SAM. DCA is checking your SAM registrations to ensure that agencies are not in debt offset. Being in debt offset precludes an agency from receiving any advances. Next slide, please. This just shows you where you can obtain the document that we're looking for upload into the Sage application. If your organization already has a SAM number, you just log into your SAM account and search for your organization. You can search by your SAM number or by your organization name, and there's some screenshots there to show you how to move through that website. Next slide. You'll click on your agency's name, and then again, my circle's a little off there, but that circle's supposed to be over the actions icon that's in the bottom right-hand corner of the screenshot. You'll click actions, you'll click download, you'll click the green download button, and this will produce a PDF that you'll upload into Sage. It is a 3-page PDF. We are looking for debt offset, so you want to make sure you scan that document to make sure it's reflecting that you are not in debt offset. That's typically on page 2 of that 3-page document. Next slide, please. All right, we're going to get into certification sheets now. This is where a lot of action happens. Next slide. The top part of that, when you click into the link, will have several questions. You'll respond to each of the questions with the organization's position. Next slide, please. Okay, this section, the screenshot's a little small, but you'll be able to see in the application. Here are the certain attachments, certification sheets. These uploads are required. What you can see for the first 3, there is a link to click where you can download the blank document that needs to be completed and signed. So that is your Schedule G, which is the certification regarding debarment and suspension. You'll click the link, grab the document, fill it out, scan it, and upload it to that link. Same thing for Schedule H, your certification regarding lobbying. Schedule I is the resolution. We'll go into a little bit more detail about the resolution in a second. That next link is where your IRS determination letter will go. That's just proving that you are a charitable organization. There is a spot for your organizational chart that was requested previously in the RFP, and then a spot to upload the signed application cover page. You need to click that link, sign it, because it needs to be fully executed, and then you will upload it to that link. Next slide, please. Here's where we'll talk about the resolution. So again, there on the previous slide, we showed you where the link was to grab this blank resolution. A signed resolution, which is also called a Schedule I with a seal or notary stamp, is the only acceptable resolution allowed. Notarization is not necessary if it's signed by your board secretary or attorney. Do not remove or add any language to this resolution. It cannot be changed in any way, shape, or form. You will simply fill it out, write the information in, sign it, and upload. I think that makes some people uncomfortable because we're writing in, but we need the resolution as it is, like this. It must be uploaded as a PDF or a Word document. That a Word document typically won't work though if we're scanning. And DCA cannot enter into a contract without that, that resolution. Next slide, please. Okay, here is where all of the other pieces of the application that need to be uploaded will go. So at the bottom of the certification sheets link from the application menu, you'll see this spot where it says, please upload any third-party agreements that may be pertinent to this grant. And there are 2 spots. So there are several documents that applicants are required to submit that don't have a designated upload link. And there are only 2 links to use for all of these uploads, which means that you must scan several requested documents into one document packet and upload it to one of the links. You might need to reduce the size of your PDFs to get them there. And you can only do this twice because there are only 2 links. There are no other spaces to upload those things. If you miss something, you will have to take down the entire packet, rescan the entire thing, and then add it again. So just be, a little bit more detail oriented when it comes to providing those uploads. Next slide, please. We tried really hard to make sure that we put in one place all of the different things that might have to be uploaded to these third-party agreements. They're listed there, and it's also listed in parentheses next to each of those documents where in the rubric you'd find that it was being requested. So all of that is there. I'm not going to go through it. Next slide, please. All right, we're going to get into your budget overview. Next slide. So if you do not complete program components first, which is on the left side of the application that Tina spoke about earlier in our SAGE training, then this is the message that you'll get. You won't be able to populate anything in a budget without a program component being entered first. Next slide. Okay, here you can see that a program component was added because we see a hyperlink that can be clicked in, and the hyperlink is green. It says Omnibus, Eviction, Homelessness Prevention Administration. Once a program component is added, the budget overview will populate. You click the hyperlink to enter specific budget items. Next slide. Okay, so this is what it'll look like when you're adding budget items. There are drop-down menus for the first 2 pieces. You can provide a more detailed information about what you're paying, and then you'll put the amount of DCA funds being requested in the box at the bottom. Use the drop-down menu to select appropriate budget categories. These are what we're recommending for admin salary, that you use admin fringe, that you're using admin personnel, either salary and wages, or fringe benefits. Space costs would go under admin operating costs, space costs. HIMIS costs would go under admin operating costs, purchase services. Program personnel and salary would go under program personnel, salary, wages, or fringe benefits. And then direct client assistance should go under program operating costs, other. Next slide. Okay, budget overview. Administration costs may not be more than indicated in the RFP, which, as we stated before, is 10% of the total award amount. You're going to place all of your administrative costs under the administrative category and not throughout your budget, so they should all be together. Do not bundle expenses. Itemize each budget expense using available system budget categories and provide details and examples. Oh, can we go back? Thank you. The state may reject any application that is incomplete or where there are significant inconsistencies or inaccuracies. Now the next slide, please. Okay, please pay attention to the following. Ensure that all application components, project objectives, scope of services, narrative, agency capacity, and budget are in alignment with the RFP. Applicants will be first reviewed to determine responsiveness, and non-responsive applicants will be rejected without evaluation. The state may also reject any application that is incomplete or where there are significant inconsistencies or inaccuracies. Do your components, objectives, and budget all coincide and align with one another and with the RFP? Are your objectives and scope of services a cohesive narrative applicable to this RFP? We are not looking for a historical summary or name dropping or use of buzzwords, but a demonstration of your actual capacity to undergo the intent and spirit of the RFP. Is your budget within the guidance stated in the RFP? And again, the state may reject any application for any missing or incomplete parts of your application. Just a note about some other contractual requirements. Insurance and fidelity bonding are required. Audits are required. Advances are 35%. If an agency is in debt offset according to SAM registration, DCA is unable to pay the advance. Someone asked before if this was a cost reimbursement model. So we will provide an advance to get you started up front. You will charge against the advance to begin with, and then it will become a reimbursement-based grant where you would spend money up front and then come in for reimbursement. Billing reimbursements are processed upon receipt of allowable expenditure uploads in the quarterly FSR. I think we'll have to talk internally about if we're going quarterly or monthly. So there could be a change there. FSRs are only approved when corresponding progress reports are submitted and after all required documentation is uploaded. Slide, please. Okay. If your application is returned for modifications, which it will probably happen, place a comment in the comment section once you have completed the modification. Please remember to click on the resubmit application button once modifications have been completed. Please don't expect modifications to be provided before the RFP due date. So we will not start to review applications until the date, which is now December 9th. Next slide. Oh, look at that. It's changed. December 9th at 11:59 is your due date. Okay. That's the end of the SAGE training that we have for you. So I'll turn it back over to Mike and Dean and the team for some questions.
Great. So Dean, happy to pass it over to you for some overall wrap-up remarks on what that is, and then I'll moderate and as you go through. Sound good?
Yeah, I mean, I have nothing else to add. I think we gave folks a lot of information and it's comprehensive, and we're going to share the slides of this deck. And then, of course, everyone has the RFP itself. So let's provide fulsome opportunity for Q&A. And I'll start by throwing out a couple of questions that I've been monitoring through the chat. There's a question from domestic violence providers that they do not have access and have not used HIMIS.
Great.
Mike?
So importantly, right, as participation in this program, right, we do require you to participate and all data entry to be in New Jersey HMIS. We've worked through this with other programs. A good example is 180 Turning Lives Around, right? They do enter information into New Jersey HMIS as an MPP provider program, right? And so we can work around that if there's a selection around that so that there's the appropriate fences and gates stood up on that.
Okay. There are a couple of agencies who may be first time with us through the SAGE process and may need some hand-holding, direct assistance administratively, and we're happy to do that. Just reach out to us and we will connect you to our SAGE administrators and accordingly help you navigate the system as it relates to getting your application in there. There were a few questions about the caps per household for direct assistance. I directed folks in my answers to those questions in the chat to pages 26 and 27 of the RFP where those caps are mentioned. There was a good question about the use of the term intensive supports. What does that mean for our purposes here? I answered that for our purposes here, intensive support households is synonymous with households that received case management. Intensive supports means case management. So we're not talking about the brief outreach and education that was provided to a household that either rejected any further assistance or that we lost touch with the household or they lost touch with us for whatever reason. A couple questions about what's the difference between the HPP navigators and the resource navigators. There isn't a difference, but we wanted to show you, especially to the HPP providers, those who have been HPP providers for a long time with us through the Office of Homelessness Prevention, that they too are getting staffing here. So resource navigators and HPP navigators are the same. They are case managers, and their performance their duties and their performance requirements are exactly the same. They're screening across assistance programs, evaluating people for supports that are going to help them prevent their homelessness or help them relocate safely and permanently, using across programs and available systems. So they don't, even though we're separating them in the chart, for all intensive purposes, there is no difference between them. They are all the same case managers with the same duties and performance requirements. I got a couple questions in here about the staffing allocations per region. Those are set. So that chart that's in the RFP that we just went over in the slide deck here, it's not a suggestion or sort of a recommendation for you in your application. The regions are set. There's no flexibility in the regions. You can apply for one, you can apply for multiple. Just show us how you're going to do it. You can apply alone or you can apply with a subgrantee. Just have an MOU and show us how you're going to do it. And there's if you have a subgrantee relationship, then there's only one lead agency, right? But the staffing allocations are set. And I invite Mike to just talk about how we arrived at those through his analyses of several factors across the board. Mike?
Sure. So importantly, one of the things that we wanted to do was we're level setting staff based upon a couple of different variables, but the first being that the agency will primarily be, the primary point of contact for operations of this program. But also, too, one of the things that we did, we also overlaid the nascent housing supports network throughout the state as part of this. So importantly, there is, and one of the things is, right, as we go through the contracting process and we move into the actual program operationalization, right, we're going to dive a little bit more deeper into aligning the housing supports program through New Jersey Family Care with this, particularly around tenancy sustainment services. And so oftentimes when we look at number of households served with this, right, more broadly defined, there might be the occurrence, right, where your resource navigator is working with 20 households and your HPP navigator is working with 20 households. Well, there's the opportunity for those case management duties to be performed from an external agency using the tenancy sustainment services, but accessing the flex funds and being able to disperse through that way, right? One of the things with this, and as we move through into this era that we are about to do, right, is we are looking for agencies that, one, want to pay their people a thriving wage, two, that are able to and demonstrate, right, that they are committed to the ideals of housing first. So I saw that there was a question about housing first and whether that's a requirement at the agency or program level. It is a requirement at the agency level, right? And thirdly, right, is that we are also moving away through this grant program of this is my grant, these are the people that we serve, we do not talk to other nonprofit providers by which we are serving them, right? If folks are uncomfortable, right, with that type of networked engagement by which we're doing this, right, this program may not be the best one for you. I'm just going to be very blunt up front on that. So Dean, did I adequately address what you think we did?
Yeah, absolutely. And I think the next question that is coming up a lot here, it's interesting to me that we have these sessions and we're doing something new here, sort of new, right? We're actually doing something that we've been trying to do in previous versions of a more consolidated, comprehensive wraparound defense to homelessness risk. And we're actually doing it this time by consolidating these two programs and funding streams. So I'm really happy about it. But the majority of the questions, at least in the chat, have nothing to do with the substance of that. And or of the client journey and or of the process and or how the different components work together, the case management, the resource navigation with the legal services providers. I have so many questions over and over again about the admin cap, the 10% indirect. So can someone from the team, either in OEP or OHP, please spell out what we're looking for here as allowable admin.
So particularly,
Jen, go
yeah,
ahead.
Jen, do you want to
Go
go
ahead.
ahead and go down the itemized list of allowable administrative expenses, please?
Sure, I can get into those. So according to the RFP, and the components that we talked about before, let me just pull them up really quickly. You guys are putting me on the spot right here.
That's why we pay the big dollars, Jen.
All right, so eligible. So admin costs typically for HPP are covering the people who are helping to support the grant without actually working the program. So if your ED, your bookkeeper, program supervision sometimes is paid from admin, things like that. We might have for admin space costs, which is new for HPP grantees in the past because there were no space costs involved then, but you might have some operating costs in that way. There might be costs for tech and travel and things like that that might go under admin, and your HIMIS and data collection costs and things that are associated with those would go under admin. We would not use, I saw somebody asked about like the 10% to cover indirect costs and things like, and as a de minimis. We are looking for, there wouldn't be like a blanket reimbursement for just 10% overall. You'd have to provide information about actual costs and expenditures in order for us to reimburse for admin costs. What I think would be the best recourse here is to put your specific information into your budget, and then as we review through the application, there will be specific budget discussions, specifically as we move towards moving through who we're going to be awarding the grant to. I don't know if I adequately answered that question or if Mike or Dean have anything to add.
No, that's perfect, Jen. Right, and so importantly, right, one of that is we are moving away as a division from just blanket admin without really discrete categories. Right. One of the things that we want to do with that is your budget as a whole, right? It is a document that even if you are scored well and you move into contracting and we move into a program, right? There is going to be some negotiation in the budget process itself, right? Through that particularly, right? While the program elements will look similar across every grantee, right? What is being paid for with regards to space and time, right? That's accurate. Yeah, it's a very good question that I just saw pop up, right? Is the 13-month term versus the 12-month budget, right? So for your staffing, right, we didn't want to confuse people on the staffing there, right? So the $65,000 a year salary floor, right, is based upon $65,000 a year annual, not $65,000 a year for 13 months. Right. So importantly, proportionally increase it, but there seemed to be a little confusion when we tested the RFP there. So please be cognizant of that budget there. Right. Importantly, going through additional, right. Right. We are looking, right, for a prime awardee, but again, there are some organizations and there's some vicinages. And Dean, do you want to talk a little bit about this because we didn't cover this, right? Where it may behoove smaller agencies in order to make a deeper impact to make MOUs with one another, right? Or to think about, all right, well, we'll be the administrative backbone and process checks and do those things, but maybe we're not the best staffing agency to staff or something like that.
Yeah, exactly. I mean, I don't, you just said it. This is we're trying to look, we know that the best way to serve people is when we bring together all of our different supports and work with each other. So this is not meant to keep agencies out. It's not meant to cause inconvenience or confusion. It's not meant to award certain agencies over others. We're thinking about the clients that we serve here. And we know that when we collaborate and create partnerships and create sort of a one-stop single point of entry coordinated support system, that's when we're more successful. We all know that. And I know that that's not possible for some agencies. And I also recognize that home rule is really tough to get rid of, right? And certain practices and the ways we've been doing things for a really long time. But again, this effort is shifting us away from that sort of automatic response that, I'm going to give you this from my agency, then I'm going to send you across the street to Mary's agency. She's going to give you another thing. And then between the two of us, we might even send you to a third and fourth person to get something else. That's just not sustainable. And this time around, with the cuts that we're facing and the policy shifts in programs coming out of the federal government and all of the inhumanity and cruelty, we're not going to add more inhumanity and cruelty.
What the hell?
Harold, please mute, or whoever that was. We're not going to add more harm to folks experiencing this serious risk by sending them around, because that's easier for agencies to do rather than coming together and saying, okay, I'm going to be the lead agency, you're going to be the subgrantee, this is the total pot of money that we're awarded for the region that we applied for. How do we work this out? How do we collaborate?
Thanks, Dean. I think to this, I'm going to move through the Q&A questions, seeing that we got about 6 minutes left. We will not get to all questions, but our team will catalog the rest, right? And we will have written responses. So Sherry has a really good question. Is there a specific form to process or reconcile expenses with HMIS? So importantly, one of the things, the reason why we have such a deep dependence on HMIS is we want to lessen the burdensome threshold of billing on you, right? We want to be able to just do an export out of New Jersey HMIS, and that is your collateral documents for billing as far as a ledger, right? That doesn't stop the other case documents that should be appended to a file. But importantly, we're not just trying to give you a separate spreadsheet to go bill on that actually just mirrors HMIS to kind of reduce that from there. Similarly, right, Sherry has another question. Can two agencies be awarded for one county, right? Right, so that is a possibility, right? But we would prefer, right, that Dean just said that folks aren't going adversarial through that, but they're doing that collectively. And then Dean, I think one thing to foot stomp real fast is, can you talk about how agencies should not be going after and soliciting legal assistance for their program, right? Unless it's adjunctive or additive to this, to their resource navigators and their HPP deployments.
I mean, sure. So the idea on the legal services, I know there's some confusion about that, so I'm glad you asked that, Mike. Let's open that up a little bit. So the idea is, in the same way that we are trying to ensure across the state, in all of the counties, in all of the regions as we set them up, that at-risk households are receiving case management assistance. We want to ensure that they're also receiving access to legal advice. And for those folks that really can benefit from actual full-on legal representation, they're getting access to that. And the idea is to create a partnership so that for households that are receiving case management, right? A social services agency has now inputted that household in HMIS, and that household has consented to the help, and we're screening them for different assistance, we're cutting checks, we're doing whatever. We want to also make sure that the legal services provider, who is their partner in that region, is also involved in the process of assisting that household, because eviction is a legal proceeding, and oftentimes having legal review can affect how the social services provider, how the navigator helps. It can even affect how much rent we end up processing in terms of arrears assistance, because there might be a dispute as to the amount of rent that's owed, or the fees associated that's added to the rent that's owed are not allowed, and so on and so forth, right? It could be that it's not a non-payment of rent case only, that there are other reasons for eviction, other grounds for eviction. So we need to ensure that we have legal eyes on everything. At least on the households that are receiving case management. That is something we failed at doing in the last two grant cycles. In some places, in the state where the social services provider and the legal services provider in the same area worked together and collaborated. In some cases, came to us with an application with an MOU between social services provider and legal services provider. It really worked well. It really met the intent, the goal of this grant. But in most places, it was all over the place. And we could not verify that, even though we were saying to the world, and when we go and get funding for this program, that we're providing social services support and legal services support to every household we assist, that wasn't actually true. Because many times the lawyers were never involved, the social services providers never connected with them, or the client came through the legal door and wasn't connected always to the social services side of things. This time, everyone's going to be in HIMSS. This time, we're going to require case management conferences weekly so that the two components are connected. And we think that that's going to allow us to really achieve our goal and ensure that we are providing legal access statewide. I'm not sure if I answered the question.
No, I think you did, and I think too, Ariel Alonso just tagged in. Yes, that the legal providers are funded by the separate line. The $1 million for legal services should not be included anywhere near your budget, right? As a social services provider on that, right? So understanding that we are at time, right? Unfortunately, both Dean and I do have a hard stop, right? Please, we will leave the chat open for another 5 minutes, right? If you want to list out your questions there, right? Please ensure that you both signed in and what that looks like. And then, right, we will go and be responsive from that. Again, just to follow up, right, we will be sending out both the link to this recording on YouTube tomorrow morning. We will be sending out the slide decks a little bit shortly after later today. And then last but not least, we thank you for your continued partnership, and then happy to give Dean the last word.
Thanks, Mike. Thank you all for joining us this afternoon. I know there are a lot more questions than we were able to get to. As Mike stated, we're going to leave the chat open for a little bit, so please, get to your question in the chat, and we will try collectively to answer all of those and then provide that information to everyone as well. I've been doing it on my own here, but they're coming in faster than I can reply to them. So we hope that this is really helpful. You're all welcome, of course, to reach out to us, as some of you have already, one-on-one with your specific questions. And we have extended the deadline by a week because we recognize that the webinar and the due date were so close together. And of course, there's a major holiday next week. Listen, we welcome everyone to apply. We're doing a really good faith effort here of telling you what we're looking for. The RFP is a long freaking document. Sorry about that. But again, we wanted to be fully transparent about all of its requirements and what really we're looking for. Please, please, please do not just submit an application that you submitted for the previous grant cycle, just changing the dates and thinking, okay, well, I kind of did this before, I'm going to do it again. We really want an application that is very specific to this presentation and to the requirements of this particular RFP. That's all I've got to say. And listen, we wish we had more money. We're always fighting for more money. And you know that we can't do this without all of you out there. We're partners in this, and we really are very grateful for the work that you do together. And we want to ensure that the people that do this work on the ground, our caseworkers, our legal services providers, are paid well and that they receive credit for the work that they do. And that's why we're harping on the data requirement a lot here today, and we'll be looking for that in your applications. We know, for instance, that you all worked really hard in the previous grant cycles and did not give yourselves enough credit in your monthly performance data outputs. They did not reflect all of the work that you were doing. So again, don't be daunted by the projected household served numbers or the minimum performance delivery requirements. We really have been thoughtful about that, and it's really based on the data that we've been seeing over the course of the last 3 grant cycles. We know that those numbers are achievable, and we actually think we're going to go way beyond those numbers. So I'm going to leave you with that, and I thank you all, and we're here for you, and we look forward to all of your applications. Thank you.